Hello everyone. The next developmental disturbances that affecting the number of teeth, that is supernumerary teeth or hyperdontia. Hyperdontia, that is the development of an increased number of teeth, and the additional teeth are known as supernumerary. The prevalence of supernumerary permanent teeth in whites is in between 0.1% and 3.8%, and it is with a slightly higher rate seen in Asian population. The most common site of hypodontia is maxillary incisor region. Supernumerary mandibular incisors are very rare, although supernumerary teeth may be bilateral and most commonly occur unilaterally. In contrast to single-tooth hyperdontia, non-syndromic multiple supernumerary teeth occur most frequently in the mandible. These multiple supernumerary teeth occur most often in the premolar region, followed by the molar and anterior region respectively. Most supernumerary teeth occur in the jaws. Examples have been reported in the gingiva, maxillary tuberosity, soft palate, maxillary sinus, spinomaxillary fissure, nasal cavity, and between the orbit and the brain. There is a male predominance of supernumerary teeth, that is around a ratio of 2:1. Several terms have been used to describe supernumerary teeth depending on their location. When a supernumerary teeth in the maxillary anterior region is there, it is known as mesiodens. In the picture you see there is an additional tooth which is present between two maxillary central incisors, that is known as mesiodens or supernumerary teeth. In the radiograph you see in the first picture there is involvement of unilateral supernumerary teeth of the anterior maxilla, which has altered the eruption path of maxillary right permanent central incisor. In the second picture you see there is bilateral inverted supernumerary teeth of the anterior maxilla. An accessory fourth molar is often called as distomolar or distodens. A posterior supernumerary teeth situated lingually or buccally to a molar tooth is termed as paramolar. In the picture you see there is a rudimentary tooth situated palatal to a maxillary molar in a patient who also exhibit hypodontia. Here you can see there is an additional tooth or paramolar. The radiograph of the same patient you see here, they are showing a fully formed tooth overlying the crown of the adjacent molar. So that is the distomolar or paramolar. Coming to the etiology of supernumerary teeth, it is not completely understood. Condition commonly associated with an increased prevalence of supernumerary teeth include cleft lip and cleft palate, cleidocranial dysplasia, and Gardner syndrome. Supernumerary teeth associated with cleft lip and palate result from fragmentation of the dental lamina during cleft formation. Coming to classification, supernumerary teeth are classified according to the morphology and location like conical, tuberculate, supplemental, and odontoma. Again, supernumerary teeth can be divided into supplemental, that is normal size and shape, or rudimentary, that is abnormal shape and smaller size. Rudimentary supplemental teeth, they are again classified into conical and tuberculate and molariform. First is conical. This small peg shaped conical tooth is supernumerary and most commonly found in the permanent dentition. It develops with root formation ahead of or at an equivalent stage to that of permanent incisors. It usually presents as a mesiodens, which is present between two central incisors. It may occasionally be found high and inverted into the palate or in a horizontal position. However, the long axis of the tooth is normally inclined. The conical supernumerary teeth can result in rotation or displacement of the permanent incisor. Next is tuberculate. The tuberculate type of supernumerary teeth have more than one cusp or tubercle. It is frequently described as barrel-shaped and it may be invaginated. Root formation is delayed compared to that of the permanent incisors. Tuberculate supernumerary teeth are often paired and commonly located on the palatal aspect of the central incisors. They rarely erupt, frequently associated with delayed eruption of the incisors. The third category is supplemental. The supplemental supernumerary teeth refers to a duplication of teeth in the normal series. It is found at the end of a tooth series, like posterior to any tooth. Most commonly found in permanent maxillary's lateral incisor, but supplemental premolars and molars also occur. The majority of supernumerary teeth are found in the primary dentition are supplemental. Next is odontome. Odontome has been listed as fourth category by Howard. However, this category is not universally accepted. The term odontoma refers to any tumor of odontogenic origin. Most authors accept that odontoma represents a hematomatous malformation rather than a neoplasm. The lesion is composed of more than one type of tissue and it is called as composite odontoma. There are two separate types has been described. The diffuse mass of dental tissue, which is totally disorganized, known as a complex composite odontoma, whereas the malformation which bears some superficial anatomical similarity to a normal tooth referred to as a compound composite odontoma. This odontoma is associated with another syndrome, that is Gardner syndrome, which consists of multiple polyposis of the large intestine, osteomas of the bones including long bones, skull and jaws, multiple epidermoid or sebaceous cysts of the skin, particularly on the scalp and back, occurrence of desmoid tumor and impacted supernumerary and permanent teeth. Then treatment for hyperdontia. The presence of supernumerary teeth should be suspected if there is a significant delay in the eruption of a localized portion of the dentition. Early diagnosis and treatment often are crucial in minimizing the aesthetic and functional problems of the adjacent teeth. Standard care is early removal of the accessory teeth or supernumerary teeth. Complications created by anterior supernumerary teeth tend to be more significant than those tend to be associated with extra teeth in the posterior region. Supernumerary teeth may predispose to subacute pericoronitis, gingivitis, periodontitis, abscess formation or pus formation, and development of any odontogenic cyst and odontogenic tumors. So these are all about supernumerary teeth or hyperdontia, that is affecting the number of teeth or increased number of teeth. I hope you understand this video. Thank you so much.